So today we're gonna go over liposuction dressing change within 24 hours. If your pads are saturated, or you can see the drainage coming through your abdominal binder. For this, you would need to have your caregiver here to do the dressing change. You would want the patient to lay down on the bed with their knees elevated so we don't have any pressure on any other incisions. So to do this, you need to have a clean workspace with your supplies. So you want to go ahead and have your pads open. You need either gloves or make sure your hands are washed and clean. So first we're going to open our pads up, have them ready. Next we're going to take the pad, the saturated pad out. And when you take the pad out, you want to look for any drainage that might be on there. Normal drainage would be red, pink, orange, yellow, that looks clear. No odor or a mild odor, all those are normal. Any yellow, white, cloudy drainage with a thick consistency or a strong foul odor, that would be considered abnormal and you would need to make a call to the urgent hotline. Once you pull those dressings out, you want to replace that with a new clean pad, and you're going to repeat this step for any other saturated dressings you might have. So you just put that through your binder, pull it through, and try to make sure the liposuction incisions are covered. If you aren't able to get the saturated pad out, that's okay. You just take your clean pad and you just reinforce that with a clean pad. So you pull that through and just do the best you can. In this video, we're going to review how to change your liposuction dressings. You will need your caregiver present, and the patient is going to lay down on the bed with their knees elevated so we don't put any extra pressure on their incision. You're also going to have your supplies, which would be pads, and we'll review on what dressings to change and what dressings not to change. So, first thing is you want to make sure your hands are clean or you have gloves. You would want to wash your hands before you do any dressing changes. And you're going to open your pads. After your pads are open, you're going to open the abdominal binder. Once you have the binder open, you want to get the pad and check for any drainage that could be on there. Some normal drainage colors would be red, pink, orange, yellow, and those will be clear colors. Either no odor or maybe a mild odor, all those are normal. If you have any yellow or white that's cloudy with a thick consistency that has a strong foul odor, that would be considered abnormal and would be something you would need to call the urgent hotline for. After you remove the old dressings, you're going to, while you're in the process of doing this, you want to look for any skin irritations that would be anywhere else. So any redness, any abrasions, anywhere that there's pressure that shouldn't be, or if you have any other skin irritations, you would look out here. If you notice any other incisions where you had a different surgery, you're gonna keep any secured dressings down. So these, we wouldn't take any of those off, but if you have any loose pads that are saturated, you can change those dressings. After that, you're going to put the abdominal binder back in place, making sure we're not putting too much compression, and we just secure it down to the black mark. That way they have the appropriate amount of compression and it's not too tight. It is best that your caregiver performs all your dressing changes. However, in the event that they are not able, I'm going to instruct you on how to change your own dressings. So first you want to make sure that your hands are clean and you wash your hands or wear gloves. You also want to make sure you have a clean working environment and you have your pads handy that you're going to replace. Next, you will lay down on the bed. Make sure your knees are up so we don't have any extra pressure on your incisions. You're going to open your pads. So once your pads are open, now you open the abdominal binder. Remove the saturated pads. You will assess your drainage on your pad, as previously discussed. Put the clean pads in. And then close the binder back over your abdomen. And make sure you're putting the end of the binder near the black line so you have the right amount of compression and it's not too tight.